Hello medical doctors, welcome to my YouTube channel. Permitted versus recognized seats in MD and MS course. What are permitted seats in postgraduate medicine offered by an institution? Hello doctors, welcome. Every academic year, when the postgraduate counseling and admission starts, the student gets confused as they do not have sufficient information to differentiate the permitted seats with the recognized seats. Permitted seats are those seats which are meant only for admission purpose, that is to admit students. These permitted seats do not have any recognized status initially at the time of starting of the course by the institution. The institution which wants to start a postgraduate program first apply to the Government of India through the affiliating university, and the National Medical Commission, after evaluation through a physical inspection, grants permission, commonly known as letter of permission, that is LOP, to the particular institution to start the postgraduate program. For illustration purpose, suppose a medical college was granted permission to start a postgraduate program in MD General Medicine from the academic year 2019-20 with an annual intake of 2 seats. This letter of permission entitled the medical college to admit 2 students in general medicine for 3 batches, that is 19-22 students, 20-21 2 students, 21-22 2 students, totally 6 students. When the first batch of admission, that is 19-20 student, normally takes the final year university examination in 2022, the medical college shall apply in advance to the Government of India, Ministry of Health, through the affiliating university, a proposal to recognize the course in that institution. The National Medical Commission depute assessors to the institution to evaluate the institutional facilities in terms of standard of examination, hospital facilities, bed strength, faculty strength, patient flow, everything, and send the assessment report to the National Medical Commission. If the assessment report is satisfied in all aspects, the NMC will issue a letter and recommend to the Government of India to recognize the postgraduate program. After the Gazette notification, all the 6 students admitted from 2019-20 in MD General Medicine got their recognition status, which enables them to register in the State Medical Council for additional qualification. Suppose if the institution has not fulfilled the certain regulatory provisions, the National Medical Commission will communicate the deficiencies to the institution to rectify it. This opportunity is given to the institution only twice. The medical college will send a complaints report rectifying the deficiencies. If they are satisfied, the National Medical Commission will issue the recognition order for the particular institution. In case if the medical college do not fulfill the regulatory provisions, it refuses to grant recognition status to the particular medical college and recommend to the Government of India to include the medical qualification for the first 4 batches in respect of postgraduate degree courses and 3 years for the postgraduate diploma program. Earlier, before 2018, only 3 batches are covered under each recognition. After 2018, an amendment was passed by the Medical Council of India that the permission will allow 4 batch of students in PG degree and 3 batch of students in PG diploma program. I have prepared a PowerPoint presentation on this for better clarity. Let me see this. The starting of postgraduate medical courses and their recognition is defined in the Postgraduate Medical Education Regulations 2000 issued by the Medical Council of India. An institution intending to start a postgraduate medical education course or to increase the annual intake capacity in an already ongoing course shall obtain the prior permission of the central government under Section 10A of the Act. The prior permission granted by the central government for postgraduate degree, postgraduate diploma courses shall be for 4 and 3 academic years respectively. This is available in the letter of permission granted to the institution. Earlier it was 3 batches, now it was 4 batches for postgraduate program. This amendment was brought in 2018. What are permitted seats in postgraduate medicine offered by an institution? Permitted seats are those seats available to filled in after obtaining LOP from the National Medical Commission. The institution shall apply for recognition of the postgraduate medical qualification to the central government through the affiliating university when the first admitted batch shall be due to appear for the examination to be conducted by the affiliating university. This permission is valid for 4 batches of admission in postgraduate degree and 3 batches in postgraduate diploma. When will the recognition process starts? For illustration purpose, if a student joined in 2019-20, the recognition process shall be instituted by the college when the joined student appears his/her final year university examination after completion of 3 years in 2022. How long it can be allowed to a student in permitted status? Only 3 years. The permitted state will be taken for recognition after a period of 3 years by the concerned medical college. In that proposal, the college should inform the actual date of clinical practical examination as per their schedule. The National Medical Commission will depute assessors on the clinical examination date to assess the standard of examination in terms of faculty strength, infrastructure, and other hospital facilities, etc. Suppose if the NMC do not recommend for recognition, what will happen? Deficiencies being found in assessment, the medical college shall be granted opportunity to submit compliance within 30 days from the date of communication of deficiencies. Such an opportunity to comply with the deficiencies shall be availed by the college only twice. The Postgraduate Medical Education Committee, on finding the compliance satisfactory, shall convey the recommendation to recognize the course. In the event of deficiencies being found in the assessment, the institution shall be granted an opportunity to submit compliance within 30 days from the date of communication of deficiencies by the Council. Such an opportunity to comply with the deficiencies shall be availed by the institution only twice. The PG Education Committee on finding the compliance satisfactory shall convey the recommendation to recognize the course. In all other cases, the prior permission of the central government granted shall be deemed to have lapsed after 4 years and 3 years of PG degree and PG diploma courses respectively. Further, in such cases, recommendation shall be made to the central government to include the qualification in the first schedule of the Indian Medical Council Act 1956 only in respect of first 4 batches of PG degree course and 3 batches of postgraduate diploma course. This is the provision found in the Postgraduate Regulation 2000. This is very important. Earlier, if the first batch is not recognized, the students will face hardship to register their names in the particular state medical council. That is why the NMC has granted one more grace year, that is 4 batches. If at all there is deficiencies and any discrepancies in the assessment report and the NMC has not recommended or refused to grant recognition status, then the first 4 batches will be deemed to have been recognized by the central government and included in the first schedule of the Indian Medical Council Act 1956. This provision is amended in 2018. Failure to seek timely recognition shall invariably result in stoppage of admission to the concerned postgraduate course. In the event of failure of the institution to seek recognition for existing postgraduate courses, the Council may recommend to the central government for imposition of exemplary penalty which may extend to rupees 10 lakhs per seat of the postgraduate course and or stoppage of other postgraduate medical courses of the institution and or debar the institution from making any application for starting or increase of seats in PG courses for a specified period and or reducing the intake capacity in MBBS. Some students may ask, how do I know the seat allotted to me is recognized or permitted? The Medical Counseling Committee, which is designated to conduct the PG counseling and admission process, the frequently asked question. This question is available in the FAQ. How do I know the seat allotted to me is recognized or permitted? The answer is, the seats allotted by MCC, that is Medical Counseling Committee, are all approved seats. Only the allotted college would be able to tell whether the seat is permitted or recognized. The reply for this FAQ is given like this. In addition, allotment of seats done by MCC is by computer software and does not differentiate between recognized or permitted. Therefore, it comes to a conclusion that ideally the higher merit candidates will be given recognized seat and the lower merit candidates would be given permitted seats. I hope this video will clarify the aspect of recognition from permitted seats as per the Postgraduate Regulation 2000 and its clauses mentioned therein. Thanks for watching. For updates, subscribe to my YouTube channel. Thank you.